Hi there, Dr. Todd Cameron here, GP and founder at M3 Health. I just want to take some time to chat to you about exemptions from COVID-19 vaccination. The reason why this has become more relevant lately is that a few sectors have had vaccines mandated. And I want to propose that we change the language, because mandate makes people feel uncomfortable. People often feel like they're being forced to do something that they may not wish to do. And so the real way to think of this is that it is related to a condition of employment. We're already used to this. So for example, if you are a pilot, you would expect that if your vision was to deteriorate, it's a condition of employment that your vision would be of a certain standard. If you wish to work in construction, you're going to have to wear a hard hat and you're going to have to wear steel cap boots. If you are to work in healthcare, there are certain requirements. If you're to work with children, you need a working with children permit. There are certain conditions of employment that we expect. And so certain jobs have made COVID vaccination part of a condition of employment. What does that mean? It means if you choose not to have the vaccine, you must find a different role or a different job that does not have this as a condition of employment. Anywhere in healthcare, it's a condition of employment. Some jobs where people work in really close proximity, like construction, it is also a condition of employment. And so a lot of people are asking for exemption from this. And I want to walk you through the guidelines, because there is no reason to have an exemption other than really tightly defined and extremely rare medical conditions. So I'm reading from a document, which is the ATAGI expanded guidance on acute major medical conditions that warrant a temporary medical exemption relevant for COVID-19 vaccines. And this was updated on the 22nd of September. So you can see here, there are some temporary reasons for exemptions. This is really important. They may reasonably be temporarily deferred for individuals with some acute major medical conditions. This does not include that you don't want it or you don't like it. And note here, it's major surgery, hospital admission for serious illness. And typically these are time-limited conditions. For an mRNA vaccine, and that is a Pfizer or a Moderna vaccine, inflammatory cardiac illness within the last 6 months, and that includes what they're saying there, myocarditis, pericarditis and endocarditis, acute rheumatic fever, or acute rheumatic heart disease. Now, these are all very, very rare conditions and would need to be confirmed by a cardiologist. And remember, it is a temporary exemption. So for all COVID-19 vaccines, ATAGI recommends that vaccination be deferred in those with PCR-confirmed SARS-CoV-2 infection. So if you have had COVID and it's confirmed on a nasal swab, then the recommendation is that you do not receive vaccination until you have recovered. That is as long as 6 months, but typically a lot earlier than that. And then you'll see down here, there is one that says, for all COVID vaccines, serious adverse events related to the first dose. Therefore, you cannot have an exemption if you have not received the vaccine. You must have received the vaccine and had some kind of a serious consequence, and that would need to be recorded in the database. So this is not something that you can just walk up and get a letter. It needs to be formally completed in the database where the vaccines go. And so we do not undertake any light completion of these, and it needs to comply with the government regulations. I just want to be really clear on that. We are not here to break any of the rules that the government has set around conditions of employment with COVID vaccination. Please do the right thing. The vaccine is the safest and most effective way to protect yourself and your community from COVID. That's what we're all here to try and get on top of during this pandemic. Thanks.